Hi, my name is Melanie Dante. The Reverend Beverly Dale has asked for me to help answer some questions on why sex workers oppose rescue. This is for a class at the Lancaster Seminary, and I'm really glad to be able to be involved with this. So in the last recording, we talked about law enforcement assisted diversion, or LEAD, as a component of why sex workers oppose rescue. With that, at the end, I concluded with the anti-prostitution loyalty oath, the conscientious clause. This is something that, as a faith-based professional, you might not even be aware that the health or social service or behavioral health organization through whom you work has agreed to this. This is called, or is part of something called PEPFAR. So let's step back, because PEPFAR is a little confusing, but it's really relevant because under PEPFAR, your organization cannot interact with me as somebody who identifies as a survivor and a sex worker. If I say that I've engaged in an act of prostitution as opposed to being rescued from trafficking, your organization is no longer able to communicate with me. You could lose all your funding. This is grossly unfair. So let's understand PEPFAR, because without you understanding that your organization may have committed to this, you can't even understand why I can't speak with you. And we want to speak with each other. The only way for us to really address the issues pertaining to sex work and sex trafficking are for all of us to be able to start speaking together as community. Yes? So PEPFAR, the President's Emergency Plan for AIDS Relief. The AIDS Act, Global Pledge, going back to George Bush Jr., right? The AIDS Act, aka U.S. leadership on HIV, AIDS, tuberculosis, and malaria in affiliation with the President's Emergency Plan for AIDS Relief, PEPFAR. PEPFAR required a pledge. The Anti-Prostitution Loyalty Oath and the Conscience Clause. The Anti-Prostitution Loyalty Oath, also known as APLO, A-P-L-O, was created in 2003. And there are these sections in there that state that there is a prohibition on the use of funds to promote or advocate the legalization or practice of prostitution or sex trafficking. There's also a prohibition to funding organizations that do not have a policy explicitly opposing prostitution and sex trafficking. So, stepping back, understand, if somebody who either was in a bad or a good working situation as a prostitute or a sex worker wanted to communicate with your healthcare, behavioral health, or social service organization, with you as faith-based and concerned people, your organization had to take this pledge not to communicate with us. The only way for your organization to be able to communicate with us would be for us to agree to go through rescue and to go through diversion, and then never to speak with anybody that we know ever again, to go through this completely new life, or we will be excluded from all services and all funding. Wow, did you know that? PEPFAR. PEPFAR is brutal. So what happened is that it was taken on. But let's stay in 2003 for right now. So the Anti-Prostitution Loyalty Oath and the Conscience Clause, right, that prohibit any kind of acknowledgement of prostitution or sex trafficking unless it's done in a rescue model, was also integrated into the Trafficking Victims Protection Reauthorization Act of 2003, the TVPA. Now, this prohibits the use of State Department anti-trafficking funds to promote, support, or advocate the legalization or practice of prostitution. It also prohibits funding to any organization that is not stated in a grant application or grant agreement that it does not promote or support or advocate for the legalization or practice of prostitution. Therefore, anybody who acknowledges that they've been a prostitute or a sex worker or supports them or the concept of decriminalization, you will lose all of your funding. In 2008, the President's Emergency Plan for AIDS Relief, or PEPFAR, included a conscientious clause. This is allowing organizations with moral or religious objectives to opt out of providing services to patients with sexual orientations of which they disapprove. Also, host countries, declared the cause, must support activities promoting abstinence, delay of sexual debut, monogamy, and fidelity. Now, this is very subjective, right? Because what one religion or culture decides is an appropriate age of sexual debut and what another does is not necessarily the same. And our language and our vernacular, our understanding, our shared understanding may not be the same. So this became very confusing, especially for people who didn't know about it and just had to respond to the effect of it. In 2005, the Center for Disease Control, the CDC, and their relationship with the Anti-Prostitution Loyalty Oath, APLO, right? So in 2005, the Centers for Disease Control and Prevention publishes a request for applications revising the AIDS funding restrictions and requiring all sub-recipient non-governmental agencies of the Global Fund, the World Health Organization, and the United Nations agencies to have a policy opposing both prostitution and sex trafficking. Also in 2005, the Global AIDS Coordinator Ambassador Randall Tobias rescinded the CDC policy modification after an overwhelming amount of backlash regarding the funding restrictions. PEPFAR and APLO, necessary bedfellows or detrimental policy conflation. In a quote by the Paulo Longo Research Initiative in 2010, the Anti-Prostitution Loyalty Oath has done nothing to reduce the numbers of women and men who, for economic and other reasons, engage in commercial sex work. It has, however, impeded access to vital HIV prevention services among commercial sex workers and has had a chilling effect on organizations that work with them. In fact, some organizations have foregone PEPFAR grant monies rather than sign the oath. Sexual activities remain the main route of HIV transmission, and commercial sex workers and their clients continue to be at increased risk for contracting HIV. In 2013, the U.S. Supreme Court declared the Anti-Prostitution Loyalty Oath unconstitutional and illegal. Quote, at issue, the loyalty oath required all organizations receiving U.S. funds designated for international HIV/AIDS work to denounce prostitution in order to be eligible to receive earmarked funds. The policy prohibits organizations from engaging in activities inconsistent with the U.S. government views on prostitution, even if financed by private funds. That quote is from Engender Health in 2013. Now, a note on this is that the ruling did not extend to organizations outside of the United States who received funding. So though it was a success, it was still limited. Now, also, despite the 2013 U.S. Supreme Court decision, APLO continued to endanger the lives of sex workers until, in 2015, Judge Victor Marrero confirmed that the First Amendment prohibits the U.S. government from imposing APLO on U.S. organizations and affiliates, regardless of where affiliates are located. Now, bringing this back to Philadelphia, correct? What we are trying to say, and not just Philadelphia, but all of Pennsylvania, For those of us that want to communicate with you, faith-based professionals who work in healthcare, social services, behavioral health, in any capacity, we need for you to understand that there have been these restrictions on us doing that unless we agree to diversion and rescue in the name of supporting law enforcement and other organizations who are completely opposed to everything that we are as people. Wow. How then can we start the dialogue to change that? I don't know. I hope that this is it. But you're going to have to let me know what you think. Do you want to have the dialogue, or do you want to consider or continue to live in a world where we cannot consider even having shared perspectives? The PowerPoint that I'm reading from is part of a presentation that I did called Sex Work Perspective and HIV/AIDS, Destigmatizing Sex Work, Harm Reduction, Prevention, and Treatment in the Field of Sex Work. This was created in affiliation with Project SAFE, and at that point, SWAP Philly, which is now SWAP Behind Bars, for the 16th Annual Prevention and Outreach Summit at the End AIDS 2015 conference in Philadelphia. I again thank you so much for taking the time to listen to me. I hope that what I say is helpful to you and therefore helpful to us in having a shared conversation so that we can move forward together to do the work that we truly are here and called to do. Have a blessed day.